All right, according to my time, it is 12 o'clock noon, and I do want to welcome all of you who have joined. This is the fifth in the series of webinars sponsored by the Healthy Flint Research Coordinating Center. My name is Yvonne Lewis, and I will be your moderator for today. We are so excited that many of you have been joining us for all 5 of these weeks so far. And so I am really excited today on behalf of the Health Flint Research Coordinating Center to again welcome you. Today we want to slow down a bit. I know my own inclination is to hurry up and get this going so that we can get all of the wonderful information in that we have outlined for you. But we do want to slow down a bit today and revisit some of the very important concepts and information that we've had questions on previously. And we'll also expand upon those ideas. As we've shared, there have been daily and sometimes hourly changes in what's happening as we learn about COVID-19 and its impact on our families and community. So first, again, we want to acknowledge some of you who have faced loss personally, dear friends, or you've learned of someone in your family from outside of the state or other places in the state, but you're continuing to do this work. You're also being very helpful to others in the community while you're dealing with your own situation. Some of us now are working at home, which we never had to do before. And it's really important to figure out how to get that work-life balance when you're actually working at home. Sometimes the phone doesn't stop ringing or we're sitting at webinars. And so we want to begin today a little bit differently than we've done before. Dr. Jennifer Johnson has previously helped us with an exercise just to help us to breathe. So we want to take a moment because it's important for us to take care of you as caregivers and those of you that are participating to help others in your family know. So I certainly want to thank you for being here listening today. So we're going to take this wellness moment and then we'll introduce some speakers and move forward. So Dr. Jennifer Johnson, would you please take us through this mindfulness stress reduction moment?
Absolutely. This simple deep breathing, it's a minute. I found this on YouTube, so you can keep doing it or click it off here, but we'll just start. It's just breathe in, breathe out, breathe deep. So breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out.
The color is a bit anyway.
Breathe in, breathe out. Breathe in, breathe out. And so I'd encourage you just to keep doing that while we talk today. It's easy and you'll be relaxed at the end.
Thank you, Dr. Johnson. I think it takes us practice to figure out how to slow down and just breathe. So as you're working on that for another minute, I want to just share with you the wonderful group of panelists that have supported us through these last 4 weeks. Our panelist list continues to grow, but also so many of them have become like family to us because they're coming back every week just to be available to answer these questions and then engage in this dialogue. So as we prepare, you'll see the panelists that are on with us today. I want to remind you, those that are listening to us right now, go down to the bottom of your screen. You'll see that Q&A button. Please put your questions in there. And as we're going through today, we want you to focus in on the conversation and ask questions about what the speakers are presenting. And if you have some other questions, we'd like to have those as well. I want to just say to you in full transparency, some of you asked some very thought-provoking questions, some of which, as a part of the work that we do, we don't have all the answers yet. As I mentioned, these things are changing. So I want to ask you to bear with us if we don't get to your particular question, because we may have to go and get some other resources to help us answer that question. And then stay tuned. So when we come back, we'll be able to adjust and answer those questions for you. There's There are some expectations that we want to kind of put some framework for, because honestly, we are not able to answer all of your questions, but we will do our best to make sure we either reference you to some other sources, but we want to make sure that this information is relevant to you. So please continue to add those questions. First, I want to go to Dr. Wolford today. You know, Dr. Wolford has been one of our regular speakers, but I've asked her just to take a moment and talk to us about something that's come up many times in our community, because we're hearing all of this information on public television, but sometimes it isn't quite clear. So I've asked her to just touch on the issue of being, to Dr. Wolford, please, if we can get to her slide first, the beautiful picture of Dr. Wolford. She's gonna talk to us a little bit about what it means to be asymptomatic, because this is something that we're really seeing a lot in our community, or we're hearing a lot about, because more people are being identified as having the virus than those who are actually ending up in the hospital. But what does this asymptomatic mean? Dr. Wolford.
So thank you so much, Yvonne, for allowing me to be with us today and be able to answer some of these questions. And I'd like to say that some questions, as you've maybe mentioned, we won't have the answer for, because we're learning more and more about COVID as the time progresses. But certainly, in regards to being asymptomatic, it means that we would have no way of knowing as an individual that we have the illness. So we have not yet developed a fever or any pain. We're sort of going about our lives just as we normally would. And the only way that we would know that we had, that we were infected, is by being tested. So the problem with that is, if we had some symptoms, we would say to ourselves, oh, I have a cough, I should stay indoors and not spread this to anybody. Or, you know, oh, I feel like I'm getting a fever, I really should call my doctor. But if you have no indication, then you could go about doing what you normally do. And what is important about COVID is that during that time, you are actually contagious. You can spread the illness to others.
Well, so while you're right there, Dr. Wolford, you know, we've talked and heard a lot about this social distancing, and that does create a little bit of a challenge for some of us. Can you tell us a little bit more? We've started trying to use this phrase, physical distancing. So can you help us really get a better sense of that?
So yes, the phrase we started out using was social distancing, which for many of us is difficult because we're social people. We like to be connected. And indeed, at a time like this, when we are dealing with so much stress and the issues surrounding COVID, we actually want to be connected with others. But what we're saying here is not that we should be disconnected or less social. It's that we should physically be separated from others. We need to put a physical barrier of at least 6 feet between us and anybody else. And the reason is because the virus is spread, in one of the ways it's spread is through droplets, these respiratory droplets. As we cough or sneeze, we let out these droplets with the virus in it. And it is thought that if we stand 6 feet away, then those droplets are less likely to get to us before they fall to the floor. So it's a way of protecting ourselves from getting the virus. We also don't want to be close to people in case we have it and we don't know we have it, and then they're breathing in the air that we're breathing out and putting them at risk.
And so because, Doctor, we're not sure who has it, now we're being told to wear some protective gear, mask, gloves. This is critically important to those who have what we call pre-existing illnesses. And sometimes, as we've talked to people in communities, like nobody's explained it to me that way. Pre-existing conditions, or even the compromised immune system. These are terms we hear on the radio, or excuse me, on the television and in articles, but tell us specifically what that means.
So a great question. Everybody can get COVID-19. Everybody can have, whether you're young or old, it doesn't matter. Any of us can get it. But our risk of getting it is higher if our immune system is not able to fight it off as well as others. So if we, for any reason, think that we may not be able to fight off infections very well, then this is an infection, and so we may be more likely to get it. On top of that, if we get it, we're more likely to have worse problems, get sicker with it, if we have an illness ahead of time. So if we have heart problems, if we have high blood pressure, some will say if we have pressure, if we have high blood sugar, if we have diabetes, if we already have lung problems like asthma, any of those things, then when COVID starts to infect us and starts to affect our bodies, it can make us sicker than it would make others.
So thank you, Dr. Woodford. I just wanted you to raise those up for us today. And I also want to acknowledge that you've done some wonderful slides that you've utilized in previous webinars. And so all of us that are listening today, we want you to know you can go back on our YouTube channel and actually see those videos and the webinars, and you can see the slides that she put forward to really give us a picture description of those things. Now, Dr. Woodford, you mentioned it's different. So I want to now go to Dr. Deborah Holden, because on last week we began to talk about these health disparities. And when you mentioned that sometimes when we have these other conditions, it might lead us to enhance the disparities, or those individuals that might die more often in certain groups. So Dr. Deborah, can you give us a little understanding of that? And I know too, you've done some previous work on this that you might want to reference.
Yeah, so thanks, Yvonne. And I talked about it a little bit last week. I think a lot of people have seen what's been popping up in the media. Last weekend, an article came out. They had 12 COVID deaths at that point in St. Louis, and they were all African American. We've seen a lot of disproportionality. So, African Americans will represent 10, 20% of the population, but are representing 40, 50% of cases. In some cities, the difference is sometimes fivefold. So they're fivefold overrepresented in the number of cases and in the number of deaths. And so I wanted to really just highlight this point that, this virus doesn't see race. This virus doesn't see gender. This virus doesn't see poverty. But unfortunately, we live in a world where poverty and race and some of those other things that we talk about, and these big factors, these social determinants of health, we're seeing now the impact of those factors on whether or not people are going to get care, how they're being treated when they show up in the system of care, whether or not they're able to access testing, and some of those other things. So I want to make it clear for people, I'm not making a case for anything, but this really is giving us the opportunity to reflect and see the real disparity and inequity that we have in our healthcare system. That those factors are a lot of what is accounting for what we see in this excess morbidity and deaths from this virus in African American populations. The other thing I want to add is I think Michigan is out in front. Michigan was one of the first states to actually report COVID-19 deaths by race. I also imagine that there are other vulnerable and marginalized populations that once we start requiring states to report the data that way, we'll see that this is not the only community dealing with disparities.
So Dr. Deborah, is there another site that you might want people to go to? I know we can go back to last week's presentation, but is there other information you'd like to point some to that might want to do some more delving into this issue of disparities?
Sure. So again, I point people back to the webinars that we've done in the past. And for people that are new to the webinar, I do really recommend that you go back because, we sort of have laid the foundation for the clinical aspects of it. Dr. Johnson is led on talking about issues related to wellness and stress management. I talked last week about health disparities. And then also one of our partners, Community Campus Partnerships for Health, is now also sponsoring a webinar series. I participated in that with one of our own Flint locals, Miss Ella Green Moten and Dr. Kamara Jones, who is the creator of Unnatural Causes. So people can also go to the Community Campus Partnerships for Health website, ccph.org, and get a much better understanding of the basic epidemiology, so the sort of distribution and determinants of COVID-19, as well as get a much deeper unpacking of what the disparities mean and what we can be doing.
Thank you, Dr. Holden. I kind of chuckle a little bit because when you talk about unpacking and epidemiology, I think, okay, wow, what does that mean? So let me go about it this way for some of us. Suzanne Kupel is on the line, and we have a couple of questions that I want to raise here for participants. And Dr. Deborah, when you talked about the Genesee County Health Department is really the key leader in this for our community. And so, Suzanne, can you talk to us a little bit about what the health department does on case investigation and contact tracking? Because I've got a couple questions that I want to use as follow-ups after you address those two things.
All right. So the case investigation starts with the person who is ill and getting all the information about that person that is ill. Contact tracing is the next step. So you want to identify who that ill person has been in contact with so that they can be communicated with. They can self-quarantine, or if they're ill, self-isolate, that they have all the information and resources that they need, because that helps us stop the spread of disease to others. This is why the stay at home, stay safe order is so important. We want everyone to be at home, staying safe, because there isn't enough testing. We don't know how widespread COVID-19 is in our community. We also don't know how many people are out there who are asymptomatic. So we're trying to minimize the spread of the virus among all of our populations. Yes, there is that case investigation and contact tracing going on, but now our numbers are at 1,149 positive cases of COVID-19 with 99 deaths. And we know that that is not reflective of likely the number of people in our community who actually have COVID-19. So we are at a place where we now need some assistance with the contact tracing. Unfortunately, the state of Michigan has been recruiting volunteers to assist in those efforts. They've vetted and have trained individuals that are assisting now with those contact tracing efforts to make sure that every person that we know is identified that has been ill is connected with, provided education and guidance information so they can help stop the spread of COVID-19 in our community.
So just to clarify, so even though the health department, you're intricately involved, that the leadership for the contact tracing is being done by the state health department.
No, that is not correct, Yvonne. What it is done by the local health department, and it continues to be done by the local health department. But when you get to the numbers that we're seeing, not only in our community, but in communities in Southeast Michigan, like the city of Detroit, Macomb County, Wayne County, Oakland County, all of those areas where we're seeing high number of cases, we don't have the capacity to just, as our local health department with our staff, do what's necessary for the contact tracing. So this group of volunteers has been organized. They've been vetted through the state of Michigan, and they are assisting now with contact tracing, giving us more arms and legs, if you will, to do this work, which is so important in trying to limit the spread of COVID-19 in our community.
Okay, so I understand that process. Like, what I'm trying to clarify is there have been some who signed up to volunteer. Would they be contacted by the state first, or would they be contacted by the local health department?
They would be contacted by the state, vetted through the state, because recognize there are issues of HIPAA and other privacy related issues here. So they are appropriately vetted and then trained in order to assist local communities like ours in doing this contact tracing.
So while we're here at the contact tracing and the investigation, there are some questions about what's happening in our nursing homes. and how should these things be reported? So one question is, are all 15 of the county nurses, can you confirm if all 15 county nursing homes have positive COVID cases?
So I will share with you that it's difficult to say at this very moment if that's the case, and let me explain why. We know that all 15 have seen cases of COVID-19, but that does not necessarily mean that the positively identified individual with COVID-19 is currently in the nursing home. They may have been transferred to a hospital. So the recognition is that all of our nursing homes in Genesee County are vulnerable. All of them have seen cases. Does that mean that all of them currently have residents that are in the nursing home that have COVID-19? That may not be so because they may have been transferred to a hospital. But that is a population that we're incredibly concerned about. The individuals at the nursing homes are communicated with the health department on a regular basis, quite frequently daily, particularly those that are having challenges with seeing the number of cases that they are seeing. We have, as a health department, set up a task force. So we have specific team leaders that are working exclusively with specific nursing homes, trying to address the challenges that they face. We regularly work with them for securing personal protective equipment. We coordinate with them to get the testing at the Bureau of Labs at the state. And there's a lot of hard work that's going on because those are vulnerable populations. We have also 47 assisted living facilities in Genesee County. We have regular communication with them, providing updated guidance and information and connecting them with the resources that they need as well.
Thank you, because that does answer another question that was raised, is what support is being given to the assisted living facility. So we appreciate knowing the health department is there, because another question was about how to report if someone suspects, even if they have a loved one or a friend that they suspect has COVID, what is the reporting process? And then I'm gonna segue this because I want Dr. Reynolds to get ready. I know he has to leave us early, but I want to segue into some of the things that the city is doing. So if you can help us to know what the reporting process is, because the department should be notified of any potential cases.
Right. So the challenge right now is that there's not sufficient amount of testing for everyone that really should be tested in our community. The health department gets information sent to us by all the laboratories that are doing testing for COVID-19, along with our 3 hospital systems, the long-term care facilities, et cetera. If anyone has any kind of concern about whether or not something is being appropriately tested, we're seeing a lot of information sent to us via our website with anonymous tips on things that they feel that should be investigated, and indeed we are investigating every one of them. Again, there's tremendous concern about the long-term care facilities, recognizing that that particular group of facilities house vulnerable populations. They are getting a great deal of attention right now. If anyone has a concern about an assisted living facility, they are supposed to be notified if there is a positive COVID-19 patient in those buildings. If anyone has any concerns, they can let us know. As a health department, we have also posted to our website under our COVID-19 section a button that allows for people who are either employers or employees that have concerns about their workplace. That includes long-term care or assisted living facilities, connections to LARA, which is the licensing bureau at the state of Michigan. And that information is available so that people can make complaints to them, and they are the licensing entity that oversees long-term care facilities and those assisted living. So those are in place to help protect people in our community.
Thank you, Susan. And if people want to know how they can volunteer for that state work, as a helping with contact tracing, getting vetted, what steps should they take? Is there something on the county website that would do that, or how would that?
We're pushing everyone to go to the state's website So it's MDHHS and it's the COVID-19 section. There's a space there where folks that have these skill sets can volunteer to assist. They go through a vetting process, again, making sure that the people that are doing this have the skill sets and the backgrounds that are needed in order to, again, work with personal protected health information. And they are appropriately trained to the state. So someone who volunteers from Genesee County may not end up assisting in the contact tracing in Genesee County, but those volunteers will be put to use all across the state, helping remotely.
Thank you. So I appreciate that. So when we're talking about the tracing and what's happening to support in the nursing homes, we know that there are other vulnerable communities. We also know that people have been tested and positively, and where do they go? Dr. Reynolds, can you give us some insights on how the city is addressing the need for sheltering and preparing for people as they're being diagnosed and need a place to go?
Yes. Now, when you're talking about someone who has a place of residence, as other speakers have said, if you have a mild presentation, in other words, you're not short of breath, you may be febrile, you may have a cough. When I say febrile, you may have a fever. You will be instructed on home care. If you're critical, then you will be referred for assessment in an emergency room. And if you're homeless, that presents a particular challenge. And even in the best of times, we've been challenged by finding appropriate placement and living space for homeless people. Under these circumstances, Carriagetown has 20 beds available, 20 isolation beds for homeless folks, and one is filled at present. So there is capacity. My brother's keeper is also involved. Now there are some plans that have been in process for the past week of finding a place for homeless folks who need just a safe room. And 2 sites have been reviewed, and it requires a lot of negotiation. So the city is still working on that in conjunction with Congressman Kildee's office. So we will see where that goes. Interestingly enough, I did get a report about Catholic Charities. Only 5% of the calls actually are in seeking housing. And it may be that folks have basically hunkered down wherever they are and are staying out the mix. We do have some concerns about homeless taking over abandoned housing or occupying abandoned housing, and that can be dangerous, especially if they need if they use an open flame for a heating source. So this is what makes finding the appropriate place for folks so important.
Okay, Dr. Reynolds, I know that there's some other work that's going on behind the scenes, and I think that's what's so important for our participants to know, that the City of Flint and all of our partners are doing work behind the scenes to make sure that things are moving forward. Are there any other items that you want the city to know, our participants to know about, that the city is doing that we may not be aware of right now?
Oh, yes. The mayor is particularly concerned about our neighborhoods that have a disparate number of people, people of color particularly, who are infected with coronavirus. We've spoken in the past about health disparities and social determinants of health, and you've heard it said often, when America catches a cold, communities of color get pneumonia. Well, without a doubt, we have pneumonia, and consistently in Flint in particular, in Genesee County in particular, although we are 20% of the population, the deaths are twice as much. In other words, 40%. So that is a disproportion that we are trying to test and address in order to refer people for appropriate treatment. So besides the testing that's going on at Atwood through Hurley Hospital, we have sought our tried and true partners at the Hamilton Family Health Network, and I'll let Mr. Pierce address that later on, and Genesee Health System. So you will be hearing an announcement probably next week about the availability of further drive-up testing.
Right. So Dr. Reynolds, while you're right there, and I'm going to put you on a little bit of a spot because we hadn't talked about this, but we know that there are language and cultural barriers. When you talk about the differences in neighborhoods, can you speak to anything the city is doing to help with this issue of making sure people of all ethnicities, languages are getting the information?
Well, let me start off with our deaf and hard of hearing population. This crisis has challenged most nonprofits, including the agency that services them. But you may notice that the mayor has always used a sign interpreter during any of his webcasts. Next, we work with the Latinx Center, and once again, for translators. But we always have to check the state website and the county website when we're looking for leaflets that are translated in several of the languages that are around this area. And that could include Mandarin, Arabic, among other languages.
All right, thank you, Dr. Reynolds. I want to go there. There's one other question. I want to make sure that we get this question answered. It goes back to tracking, and there's a question about cell phone tracking for contact tracing. I want to come back to that in a moment, but we do need to hear from the schools, because there's another issue when we talk about things being disproportionate, which it means people don't always have the adequate access to programs and services. I know our schools are working diligently, both the Genesee Intermediate School District and the Flint Community School District. So if we could go to the slide from the Flint Community Schools about their program. I'm going to ask Anita Stewart, yes, back up one. Yes, thank you, right there. I'm going to ask Anita Stewart, who is working in the office there at the Flint School System, to talk to us about what they're doing to make sure that all of our students have food.
Thank you. We have increased our sites. We've increased our sites from 7 to 12. We have 4 sites that are in the North Zone: Northwestern, Brownell Homes, Burston Fieldhouse, and River Park Apartments that is servicing the Carpenter Road area. We have 4 sites that are in our Central Zone: Potter, DTM, Stonegate, and Summerfield. And then we have 4 sites that are on the South Zone: Freeman, Howard Estates, Evergreen Regency, and Southwestern. We have, as of April 13th, we have limited our contact with the community and the community contact with us by going to 2 distribution days. And those days are Tuesdays and Thursdays. It is, I want to note that we're not limiting the meals that we're giving our families, because they're still getting the same amount of meals that they would get if we were distributing Monday through Friday. But we just wanted to make sure that we were taking some extra precautions with limiting the community's contact with us. And the time on Tuesdays and Thursdays is 10 a.m. to 1 p.m. And if you are not able to get to any of our distribution sites, we're asking that you send us an email at superintendent@flintschools.org so that we can make sure that we assist you in making sure that we feed all of the children in the city of Flint.
Thank you, Anita. And we did talk about this a little bit. We know that sometimes people are challenged with the technology, so they're working to try to make sure that everyone has access to these services. So because the schools are closed, you can't go to the school and go inside, but please make sure that if you have someone that you know, and I'm speaking now to all of those of you that are doing this work. We talk about a lot of outreach that's being done. If you're one of the outreach workers in any way, please help your families that do have these challenges with technology to connect so that they can have these resources. Anything else, Anita, that you want us to know before we go to the Genesee Intermediate School District? I think Tricia Hill is on the call.
We do have what we call a wellness team, and our wellness team, they are making contacts with our families weekly just to check in on them, just to see how they're doing, to help them navigate any barriers that they're facing. If they're having any technology issues, we're assisting them with their technology issues. If they're in need of resources, we're helping them to connect to people in the community so that they can get the resources that they need. As of this point in time, our wellness team has made over 8,000 contacts with our families. So we are keeping in constant communication with all of our families so that we know that they're safe, and whatever needs they have, we're helping them to navigate through those needs.
Oh, you are reaching out. Thank you so much.
Yes, ma'am.
All right, Tricia, tell us what's happening at the GISD.
Hi there, how are you?
Hey, how are you?
Good, and thanks, Anita, for that report. We really appreciate all that Flint's doing to support your students. And
Thank you,
just to
Tricia.
talk about, you're welcome. Food distribution, on the GISD website, we do have a full list of food distribution sites for every local district and charter school in the county. We are trying to keep that maintained as school districts are revising their schedules due to trying to limit that contact with the community and giving out multiple meals per day. And there are some home delivery options also, as Ms. Stewart had mentioned as well in Flint throughout the county. So just keep updated on that because the schedules are changing due to need.
Thank you.
Also, I just want to add too that districts will have a continuity of learning plan approved by the Genesee Intermediate School District and sent to Michigan Department of Ed by April 28th, and those should be on every website. And what those plans do is they talk about how schools are going to support student learning during the shutdown through the end of the school year. So very specific on what schools are doing for every grade level, what resources are there, what supports are there, so parents really know what to expect. And every school district is really trying to address that barrier of access. So it looks different in every district. And again, I really appreciate, Yvonne, what you said. Just reach out. Schools are there, they're ready to serve, and they're ready to assist.
Thank you, Tricia. And to both of you, we appreciate you bringing this information because we have a lot of helpers on the line and they can get information to the families in a real-time way for those calls that they're making and the various ways that they've developed to keep in touch with those families. So thank you for giving us this information.
Yvonne, can I add one more thing real quick?
Yes.
We also have went live with a social emotional helpline for students, and it's 591-HELP. And we will be answering that phone with licensed professionals such as counselors, social workers, and therapists. The idea isn't to have therapy sessions on the phone, but connect students who are struggling with resources that are available in the county, or parents with strategies to help deal with stress management.
Okay, great. And so I want to ask this question now again and I'm going to come back to you, Dr. Reynolds. So don't go away. You got a couple minutes before you have to leave us. So what I want to share is that for those of you that are doing this outreach work, please remember that you can help by sharing what you're learning with all of these organizations that are on this webinar. And I'm sure they'll be happy to hear what you have to say that will enhance the work that they're doing to make a difference for our community. So I do want you to remember that. Dr. Reynolds, I saw your hand raised.
Yes, I didn't get a chance to give my usual request. If you are a smoker, stop smoking. If you are a vapor, stop vaping. Your lungs are one of your most sensitive organs. If you don't breathe, you don't live. So if you are vulnerable for the effects of this virus. So please, if you care about yourself and you care about the ones who are in your living space, stop smoking, stop vaping, protect your lungs. And if possible, if my colleague Billy Mitchell our public health manager can speak about some of the other developments. Is that okay?
All right, since you segued in that, and Billy Mitchell, your name is on the slide right now as a manager of public health. What are those tips that you want to give to us?
I kind of just wanted to give some updates. Can you hear me?
Yes.
Okay, some updates about things that residents can do during this time. So we do have the water filter delivery and the water test kit delivery and the water delivery still going on. And residents can have those things delivered to them by calling 810-410-2020.
Would you repeat that number again?
810-410-2020.
And Billy, I thank you for raising that, because on a call yesterday, one of the participants said, you know, we're in the midst of COVID, but for Flint, we're still dealing with the water crisis. So it's wonderful that you remind us that the help centers are still available for us, water is still being distributed, and it's important that the water filters, filters are available for people still to pick up and use in their homes. So thank you so much for that. Oh, there he is, Dr. Tupper. This is so perfect. You, those of us that see Dr. Tupper, he has on his personal protective equipment, because Dr. Tupper, we can go to the Hurley slide. Dr. Tupper is actually on the ground at Atwood. So Dr. Tupper, can you give us insight on what's happening at that testing site?
Yes, hello. Thank you. I am calling live from our testing center at Atwood Stadium. We are doing drive-through coronavirus screening and testing. How the process is working is we have our COVID hotline, and I'll read off the number right now. It is 810-262-3685. Again, it's 810-262-3685. And the testing here is by appointments. So we're making appointments on Monday, Wednesday, and Fridays from 10 a.m. to 2 p.m. And we're currently testing 50 a day with support of the state of Michigan and the City of Flint. And our goal will be to hopefully increase that over time as the testing supplies allow. In order to make an appointment, you get screened by a nurse. You have to meet criteria for testing as determined by the Michigan Department of Health and Human Services. But that you do not need otherwise need a doctor's order. You call the number, they ask the questions for screening for eligibility, and then you get an appointment and you drive through. There's a introduction process. We register you, and then we do the nose swab. And so that's where I am right now, and that's what's happening.
So it's a nose swab. Now, Dr. Tupper, you have to help us, because most of us, I know I've seen it on TV, but I'm not quite sure how that works. Can you give us a little bit more insight on the process utilizing this nose swab?
Yeah, so it's called a PCR test. That's the type of test that's run. It's basically just like a cotton swab. Here, I'll have a little bit. We can even show you. It's basically just a little swab here. It goes up your nose. We swab the nose a little deeply. It's slightly uncomfortable, but very brief. Then we put it in a tube and we send it off to the lab.
Thank you, Dr. Tupper. And again, that number for people to call, and I don't know they need to call early because you're only taking so many appointments per day. So they can call the hotline for Hurley, and we'll make sure that this is on our information for next week as we repeat this. That number is 262-3685.
Yep.
Appointments between 10 and 2 p.m. every Sunday, Wednesday, and Friday. I want to thank you, Dr. Tupper, because we heard the governor mention that there would be tests available in Flint on Monday. And Hurley stepped up and has got moved that forward to start on this past Wednesday. And we understand that Hamilton will be joining in another week. So
Great.
all the work that you're doing to make sure that our community residents have an opportunity to get tested. Now, here's the thing, and there is priorities, right?
That is correct. So
give us some insight on that.
So currently we're testing based on the prioritization recommendations as set forth by the Michigan Department of Health and Human Services. And so a few things just to know. We're currently not doing asymptomatic screening. So if you do not have any symptoms that are consistent with the coronavirus, we're advising to monitor for the development of symptoms, but we're not doing screening at this time. You have to have 1, symptoms. 2, in accordance with the recommendations, for prioritization, not everyone with symptoms can be screened. There's a whole screening process of criteria that is changing over time as based on recommendations. But the general typical things are those that are at risk for having more severe illnesses, such as those older than age 65, those with some chronic medical conditions. And then we are also screening healthcare workers and critical infrastructure workers. And that would include things like first responders, police officers, but also those so important to our infrastructure right now, including grocery workers and others that have essential jobs to keep our services open. So again, must be have symptoms and must meet other screening criteria. But that's the process and the recommendations that we are following right now.
Thank you, Dr. Tupper. I know there's so much more. I really want to one of the things you said right there toward the end is even the grocery store workers, because those are essential individuals that we need well. So there's more to come. We just don't have enough tests in our community yet, but we appreciate the testing that is being done, because this is important. I know there's some other questions about protective equipment. We know that there's seemingly not enough of that. So I'm going to ask one of the panelists if you see can go in and answer that question about protective equipment. One of the things that comes up when we're addressing the disparity, people that do not have health care coverage. This is a real critical thing for people that have health care coverage. So I want to go to Jim Melanowski, the health plan, talking about the health coverage. So we can move to that slide that shows the to address individuals who need health coverage. Thank you. Jim, please.
Yeah, so you can see the slide. We are still assisting people over the phone. Healthcare coverage is crucial. So we can get people signed up on the Genesee health plan. We could also help them sign up for Medicaid, and it's a little bit easier to do that. And people are calling us, and they're calling the Department of Health and Human Services. And we got a report yesterday. There were 1,500 people calling a day to between all of us to get healthcare coverage, Healthy Michigan or Medicaid. Especially those people who have just recently lost their jobs and their health care coverage. So we don't want to not take care of ourselves. I think Dr. Reynolds talked about that we want to make sure we're taking care of our chronic health conditions, and now's the time not to forget about those, or if we need to see the doctor about other things other than the COVID-19, we still need to take care of ourselves. And the providers out there, the medical providers, the primary care doctors are doing a lot of telehealth, also in person. So a person should call their doctor if they need to make an appointment, and still take care of themselves. And otherwise, they're going to be vulnerable. But we want them to still continue to be healthy. So those are very important things. We can also enroll people into the Affordable Care Act, the Obamacare, the healthcare.gov site. So really just calling us and we can kind of walk through all of that, I think is really, really important. And we have a staff, a lot of them are on the call right now that can help with that. And we still have our community health workers are there to help people identify resources that are out there. We have health navigators and nurses to run things by. And then the last thing I'm going to talk about is prescription assistance. Sometimes our medications are not covered, or if you lost a job and you have to pay out of pocket for a medication, there are programs out there, and we have a great staff person that can assist them in applying for those resources to get their prescription drugs covered, either 100% or at a really good discount.
Now, Jim, I know the health plan works with a lot of individuals who are uninsured. That's why the health plan exists. But we also have people who are not in a position to get some of the protective gear. And this may not be something that the health plan is able to address right today. But I think if there are any insights on what people might do, and this could be for any of the panelists, if they're tested positive and they don't have protective gear, protective equipment.
I know I would not know where to send them to, but I'm hoping one of the panelists would.
Okay, so if one of maybe Suzanne from the health department or somebody can help us. If not, what we'll do is make sure that we put that forward and see what's going on around our community, someone that might be helping with that issue. Did I hear you coming forward, Suzanne?
So I just wanted to let you know that the materials that we've received for protective equipment are meant for healthcare professionals as a health department, but I'll investigate to see if there are other resources that we can connect you with.
Thank you so much.
Hello, this is Dr. Reynolds. Now, we have to remember that we have a background of improvising. So you can make your own mask. You can cover your face with a cloth. It's better than nothing. Okay, number one. And you will need to clean that. And it washes in soap and water. Soap and water kills the virus. Hot water and soap kill the virus. The other thing I went to when I could not find gloves is use the dishwashing gloves or get shop gloves that are rubber and waterproof, and you can soak them in a soapy bleach or a bleach solution. And as I've said before, only mix bleach with water. Do not mix it with any other cleaners. So there's things you can make do, and you still have to wash your hands. So never forget that. Always wash your hands.
This is Suzanne. I wanted to remind everyone that on our website, there's a video of the Surgeon General making masks. We have lots of information about how to make your own mask. And Dr. Reynolds is so correct. We really need to make sure that whatever we're doing, we're using them appropriately and cleaning our hands or using hand sanitizers before we put them on and when we take them off as well.
Thank you. Now we're moving swiftly toward our closing. There are some other panelists that I want to hear from today. Brenda Jegede is on from the state. We've heard a little bit about what the state is doing. Brenda, any additional updates from the Office of Minority Health that you might want to make us aware of today? Brenda? Okay. And I want to, okay, you have to. All right.
Sorry about that. I had to just unmute myself.
Okay.
So thank you very much again, Yvonne, for the opportunity to just share some of the information that we have. I heard a lot of the information that have been shared by others and just will add to some of that. One of the things that we continue to emphasize the need for is data based on race and ethnicity. And as was mentioned, we were one of the first states to report data by race and ethnicity. And that's something that's absolutely a priority for our area, our Office of Equity and Minority Health. We focus on collecting data for our 5 main racial groups, racial and ethnicity groups in Michigan. And so for years, we've partner with our epidemiology area and other internal and external partners to make sure that we're establishing protocols around collecting and reporting that data. So in addition to reporting what you've seen as race and ethnicity, and initially the ethnicity had included our Latinx or Hispanic population, we also just started reporting for our Arab population. And there's a lot of challenges with collecting data from what our systems are set to collect, say for instance, from our laboratories. The system currently that we use does not include race and ethnicity data. So for instance, the information goes from the hospital or the physician to the laboratory. And then when it goes to the health department to collect that information, they're the ones mainly getting that information for us. And then additionally, we're doing some measures where we're looking at death certificate data so that we make sure that we're capturing information. So we're doing a lot on that end just to make sure that we have that data so that we can make some informed decisions. And I wanted to mention that we're also just looking to see how at this time we can improve our data collecting systems, either to help us now or to put things in place to help us for when the next, disaster or crisis takes place. So just wanted to mention that, and we're also looking to make some decisions more specifically about our areas in Michigan, some of our communities in Michigan, so that we could advocate for resources in those particular areas where we have marginalized communities. We've already, that's one of the main things I wanted to mention. And there are, I'll just say, a lot of updates. People have mentioned them to some degree in terms of various executive orders. And one of the things I heard about the contact tracing is to please have members answer the calls. They may see that 517 area code, and we're trying to get information and do that contact tracing.
Thank you, Brenda. I think it's really, we appreciate you taking the time with all that's going on at the state to be here and give that voice. But I also know that you're listening to hear what you can take back to make sure that you advocate on our behalf, which is a good segue to why we all need to complete the census, because this is another way we make sure that we have resources available for our community for the next 10 years. We're just about out of time. I do want to hear from Isaiah Oliver real quickly and Afton Shavers from the Greater Flint Health Coalition about the Flint Registry. So Isaiah, what's a quick update for us? Isaiah Oliver, the Community Foundation of Greater Flint. Okay, may have had to jump off unless he's unplugging his phone. Afton, can you chime in real quickly for the Greater Flint Health Coalition?
Yep, I'm here, Yvonne.
There you go. Yes, ma'am.
Right, so all of the Health Coalition community programs are still active and running remotely. This graphic will give you basically all the contact information for each one of our individual programs. But if you have any questions in general about any of the Health Coalition programs, you can give our main office a call, and that phone number is 232-2228. So we have a coverage team that's also assisting with getting folks connected to health insurance. We also have some food resources that we're sharing out via our Commit to Fit team. We are also obviously working with families that need access to resources via our CHAP team. Our social workers and our nurses are actively helping connect families to resources that they may need in that area. And lastly, registry. We are still actively helping folks enroll in the Flint Registry. We have a whole lot of people who have pre-enrolled, meaning that they started the process, but we have a lot of folks that have not completed that full process. So our full registry team is able to assist people via phone. If you want to call 833-463-5468 or 833-GO-FLINT. They can help you over the phone, or you can send an email to flintregistry@hc.msu.edu. And you can also enroll for registry on the website, which is flintregistry.org.
Thank you, Afton. We're going to ask people, we're going to leave this up for just a quick minute, but we're going to ask you now as we prepare to close for the day, just a couple of other quick things. Please go back and review the webinars from previous sessions because this information is made available to you. The MTA is also wanting us to know that the changes that they put in place, if we could put that slide up right quick for MTA, the changes that they put in place, they still are, the fixed routes will still be closed until May, I believe it's May 4th. So you can still, however, call your ride at 810-767-5541. They are still providing the Your Ride services for essential trips only. It is just amazing to me how quickly our time goes by, and I hope that you benefited from this session today. We want you please to remember to complete the pop-up post-webinar evaluation. You know, if you hold on just slowly as you close out the session today, it will pop up there, or else you will be receiving an email link later. We have been asked to continue the webinars, and so we will be here with you weekly until further notice, and there'll be details. We want you also to go on and subscribe to the HFRCC YouTube. That way, you'll have access to all the information that has been shared on the previous webinar. We'll be able to get you information coming forward. Email any questions that you might have to us at info@healthyflint.org. And remember, there's so much information. It's changing daily. And we're going to do our best to try to make sure we're relevant and respond to the issues that you raise to us. So again, thank you today for joining us for this 5th webinar in the series, Flint Community Webinars on COVID-19. We're in for the long haul here with you. We're asking you to help us as we go forward to make the change in our community that our community needs. Thank you so much for joining us. And we look forward to you being with us the next time.